Folks around the Low Country are training up for this year's Cooper River Bridge Run. But if heel pain has you sidelined, there are ways to get some relief. For all the answers, we're going to turn to Dr. Andrew Saffer from East Cooper Regional Medical Center. Good to see you, Dr. Saffer.
Thank you for having me.
Now, this is a very common problem, and in short, in layman's terms, it's heel pain. What exactly is it?
It's heel pain. There's many forms of heel pain, but the most common being plantar fasciitis. And plantar fasciitis is an inflammation of the ligament on the bottom of the foot. It can really cause severe pain. And typically it's pain first step out of bed in the morning, and then it just gets a little bit better as you sit down, but as you stand back up, it's painful.
So just by not moving your foot, it actually gets even worse?
It does sometimes, yes it does.
Now, is this something that is caused by repetitive motion? How do you get plantar fasciitis?
It is overuse, maybe doing too much too soon in your exercise routine. You may have a job where you stand 10 to 12 hours a day, and that puts a lot of strain on the plantar fascia, and also being overweight.
Okay. Now, when you do have this pain, is it something that you can cure by stretching? Do you need inserts for your shoes? How do you take care of it?
Well, the good news is we have about a 90% cure rate with conservative treatment in our practice.
That high?
Yes, it does, which is very encouraging. And usually stretching exercises help to stretch the plantar fascia and give it more flexibility. And something really simple that you can do is icing. You can just take a frozen gel pack or bag of peas and ice massage, and that really helps to decrease the pain and inflammation.
Now, are there varying degrees of pain, if it's just a minor case or a major case, things like that?
Well, the key is to come in early. If you wait 6 months to 10 months and come in, it's a little bit harder to treat, so the key is to really catch it very early.
Now, is this something that would be covered under insurance?
Yes, actually, custom orthotics are devices that we use for plantar fasciitis, and they actually do, majority of insurances do cover custom orthotics.
See, now that kind of surprised me because you said you can get up to 2 inserts for your shoes?
Yeah, you can, and which is very, very convenient. You can actually use so you don't have to change them from shoe to shoe. You can actually use one orthotic for your running shoes and one orthotic for your dress shoes.
Now, you were talking about you actually take photos and send them off to a lab to analyze them?
Yes, we have a new technology in our practice where we actually take a three-dimensional image of the foot. And we've really found that we've made more precise orthotics with this type of technology.
That's unbelievable. Now, if folks are out there and they do notice some heel pain, what should they do? Should they call you ahead of time, set up an appointment? Is that the first step?
Well, the key is to really know that there's different causes of heel pain. It's not just plantar fasciitis. It might be something more serious like a bone tumor or a stress fracture. So it's very key to come in as early as possible. And some of the treatments of the stretching exercises like we talked about, and the mainstay is really the custom orthotics.
Now, does this pain, because I get pain in my foot from running, but it's not exactly in the immediate heel. It usually starts up toward the arch and works its way back toward the heel.
It does. I mean, the plantar fascial ligament inserts or goes from actually the bottom of the foot and extends to the toes. And it can really cause a really bad inflammation, but typically it's pinpoint pain right on the bottom of the heel.
Oh, wow. And you were also talking about some of the treatments for this. You can come into the office and maybe even walk home after the treatment?
Yes, actually there's a new non-invasive treatment. If the patients haven't responded to conservative treatment, there's a treatment called shockwave therapy. And this is typically an outpatient procedure. Shockwaves are sent into the heel, and this really decreases the inflammation of the ligament and breaks up scar tissue.
So just by getting in there early, getting the early diagnosis, you can avoid surgery in the long run?
You can, and what's nice about the shockwave therapy is you can actually walk home in sneakers after the procedure.
That's great. So how do we get a hold of you, Dr. Saffer?
Yes, we are on CarolinaFootSpecialist.net, and we have lots of information on heel pain as well as all type of foot injuries.
And if you have any other foot pain from training for the bridge run, just give you a call, correct?
Yes, sir. Yes,
all right. Well, Dr. Saffer, thank you very much.
Thank you for having me.
All right. Good to see you. Well, straight ahead.